Welcome to Mo Health Media. My name is Guy Danhoff, and we are Missouri Healthy Schools' newest and trying to be your most trusted resource for providing the latest updates, information, evidence-based resources, also conducting interviews, panel discussions, and much more. We're really excited today to be joined by two very special guests. And our first special guest is going to be Dr. William Potts-Datema, as he has served in education and public health for over 39 years, including service from the local all the way to the international levels. He has held a number of national leadership positions, including the Chief of Program Development and Services Branch of Centers for Disease Control and Prevention, as well as the Division of Adolescent and School Health, Director of Partnerships for Children's Health at the Harvard T.H. Chan School of Public Health in Boston, Mass., and the Executive Director of the Society of State Leaders of Health and Physical Education in Washington, D.C. He is also an adjunct professor in the School Health Education Graduate Program of Southern Connecticut State University. Dr. Potts-Datema also serves on 4 national boards. He also holds a Doctorate of Public Health degree from the University of Georgia and a Master's of Science degree and Bachelor's of Science degrees in education from right here in Missouri at Missouri State University. I want to welcome you, Bill, to our broadcast.
Thanks, Guy. Great to be here.
All right. Our second guest is Sean Slade. He is the Director of Global Outreach at ASCD, where he leads the promotion and the expansion of the ASCD's whole child approach and mission. During his 3 decades in education spanning 5 countries and 4 continents, he has spoken and written extensively on topics related to the whole child, health, well-being, school climate, and the promotion of the ecosystem approach to educational systems reform. Not that long ago, in 2014, he led the development and the launch of the whole school, whole community, whole child model known as the WSCC, in conjunction with the U.S. Centers for Disease Control and Prevention, which has become the preeminent school health model used across the U.S. and driving force framework for the alignment and the integration of health and education. We want to welcome you, Sean, and we are so excited that both you guys are here. Bill, I know you've been pretty busy. We saw you last Thursday right here in we'd put on a statewide webinar that you were part of, and I kind of want to just start by jumping in right there. And one of the things that you guys were talking about during the building your system to support your whole school community was this whole notion of fundamental health. And it seemed to me that after you guys went through the 10 tenets of the WSCC model, that the fundamental health, when you look at the people that are part of COVID today, on part of that COVID task forces that school have, there's a lot of alignment going on. I was wondering if you could kind of frame that for us, and is that true? Do you see that alignment?
Yeah, sure. Thanks, Guy. This may be the most difficult start to school that we've experienced in the 39 years I've been involved in education. And all of that is due to having to shift related to coronavirus. The schools that have whole school, whole community, whole child models and have those councils in place were able to take this challenge and put it right into that model. They had the relationships developed, they already had the people in place, and they were able to, they've worked together before on other challenging health issues. So they had the advantage of being able to bring order to the chaos that we see sometimes that affects school districts related to health issues. So rather than just addressing nutrition and physical activity when they had the wellness requirements, or addressing some community issue when it popped up, they were able to take this new challenge and put it into a system that is sustainable and brought that order to the chaos.
Yeah, I would agree wholeheartedly with Bill. And Bill, by the way, just so listeners and viewers know, was also part of the WSCC model development and launch back in 2014 when he was working at CDC. So he's been fundamental in this release as well. But foundational or fundamental health, one thing we've been pushing is that health and well-being is key for schools and key for education. It's not just fundamental for developing the health and the well-being of the individual, but it's also fundamental in developing effective pedagogy and effective teaching and learning. And one of the reasons that ASCD was involved in the development of the WSC model was that we sort of understood from a couple of decades ago, really, that the schools that are focusing on health and well-being and connections with their community, as Bill was just saying, are the same schools that are developing the most effective teaching and learning environments. And for the longest time, we've talked about these two things in silos. We've talked about developing health, mainly physical health, over here, and developing effective schools and learning over here. And what we've been saying and what the WSC model shows and says is that these two things need to be together. And what's been remarkable, both alarming, but also remarkable during reopening of schools in COVID, is it is those schools that have those, one, that fundamental mindset that health and well-being is foundational to education, but also those schools that have those connections back into their communities, back into their health services. They're the ones that are doing the best in this really trying time.
Well, with that, guys, I mean, Bill, you talked about this last time, and you guys had Dr. Ashley Krause on, who I've had the privilege of interviewing her 3 times since November of last year, you know, right there in her school district in Farmington. And she speaks a lot about strengthening the education of everyone involved, all the stakeholders. I was wondering maybe if you could speak to that a little more, because it seems like when you get that education piece going, where people are now reading from the same playbook, you're starting to see better results, Sean, as to what you were saying. So I was wondering if maybe you can speak to how the WSC model is strengthening the education.
Sure. So the WSC model is founded on the 5 tenets that ASCD put together through the Whole Child Commission that they developed in 2007. Sean can likely speak more to that briefly, but also it brings together the health piece, which is the coordinated school health model, or
right.
the 10 components that a school system have that can address each of those health issues and strengthen education. At this point, the research is clear that health and education are linked. And if we can work on some foundational health issues, those can strengthen our educational outcomes as well. So the model is designed really as an education model. It's designed to be used in schools as a way of bringing the community, the school, and all of their assets together to strengthen those 5 tenets that are necessary for a good educational system.
Yeah, and Sean?
Yeah, I would just, again, follow on. When we developed, as Bill was saying, the 5 tenets of Whole Child, which you see in the green in that model, the healthy, safe, engaged, supported, challenged, we actually based it on Abraham Maslow's hierarchy of needs. So fundamental things that people need to not only survive, but then to thrive. And so there is a reason why the first 2 tenets that we talk about are healthy and safe. Because if the kids aren't healthy, if the staff aren't healthy, if the environment's not healthy, then they won't either be at school or they'll be in school but anxious and nervous and scared. We understand that we need to make sure that the learning environments are healthy, and not just physically healthy, especially in this time, but also socially, emotionally, and mentally healthy. And that everyone who is in that environment, and that environment right now can both be in person, but also online, that they feel safe and connected. And then once we get those foundations, you start looking at engaging the students in the learning. You start looking at supports that teachers and counselors and the community can provide. And then you start looking at ways that you can challenge each child in their learning, and making sure that it's not just, when we get to challenge, it's not just making sure that there is harder material, but we're actually looking and knowing the individual and making sure that the learning that we give them is appropriate for their learning and extends them. And so when you look at the WSC model, it has the child in the center. It has those educational tenets that ASCD developed around that child. And then it starts to frame it inside some of those school health components to make sure that all of the major players are not only present in the planning and the implementation, but they're also collaborating and coordinating with each other. And then, you know, Lloyd Colby, who I've always called the grandfather of coordinated school health, along with Diane Allensworth, the grandmother of coordinated school health, we're talking about really making sure that this model was then placed in the community. Because we want schools to be mirrors and the hubs of their community, not islands. So it's hopefully it's a framework, especially in this time of COVID, that can make sure that the right people and the right roles and the right services are at the table and in discussions about not only reopenings, but also about how we make sure that health and well-being become sustainable, foundational aspects of each school.
That's awesome. And with that, I do want to point this out because, as you guys know, with what's happened since COVID began, and like you guys just to briefly speak to this, this model also works regardless of the way that you go about having your education set up. You could be going face-to-face, you could be going hybrid, or you could even go completely virtual. And the WSC model covers all three modes of delivery. Is that correct?
Yes, and you know, you can have council meetings virtually, just like you might have them at a school. So it's really about building the system and making sure that the system is in place and that you have those relationships built and that experience working together so that you can apply it to any issue. It really makes it very efficient and cost effective.
Yeah, and it's really, when you look at it, so we're not saying this has to be in a certain environment and the school has to look in a certain way or have certain a number of facilities involved in it. What we're talking about with the model is basically, it's a model which underpins foundational human development, and that includes child and youth development and effective pedagogy. And so it doesn't matter, as we're experiencing ourselves in our family, and most families are experiencing this to some degree, even if the students are learning online or learning remotely, they still need to have a social and emotional connection back to their teacher, back to peers, their classrooms, and their school. So they're not learning from a device. They're actually doing the same engagements or trying to do the same engagements with their peers and with their teachers, which we know is effective pedagogy. And so again, what you'll hear me say a lot of the time, if people hear me talk or have heard me talk, is we use different phrases and different terminologies in the different sectors, whether it's health or education, but we're talking about the same thing. Knowing your students, worrying about if they're feeling safe, if they're healthy, if they're nervous, if they're anxious, developing those relationships. All of those things are fundamental parts of focusing on the health and well-being, and they're foundational in getting effective teaching and learning and effective pedagogy throughout every class.
Absolutely. And speaking to that, just to let our viewers know that you guys can both, our viewers, that is, you can see both these guys coming up on October 7th, as well as October 16th. There's going to be 2 statewide webinars, again, put out by DESE, also Missouri Healthy Schools. And it's going to be pretty exciting, again, that you guys will be going through that, building the system to support your whole school community. So it's going to be really exciting. We'll be putting out certainly all kinds of information of getting that registration so that you guys can take part of that. And of course, what I love that both of you guys do is you guys have a time period for an open live Q&A. And that's where people can really, get their, can sink deeper into the things that matter most to them. So with that being said, I just want to kind of finish up our last segment and kind of just bringing it to what's going on here right now with DESE, right here in Missouri. And that is this. I was recently on the DESE website, and they have their strategic planning, which refers to four priority areas to support their vision, and here they are. The first one is early learning and early literacy. The second one is success-ready students and workforce development, safe and healthy schools, and educator recruitment and retention. So Missouri Healthy Schools supports priority areas that are safe and healthy schools, as well as and success-ready students and workforce development. And here's my question. Can you say why this works?
Yeah, sure. Certainly the model supports the success of students. As I mentioned earlier, the links between health and education are strong. And the entire model is built around helping students succeed, helping them not just be healthy, but also be very successful in school. It also helps, as I mentioned earlier, with bringing order to the chaos, which can help educators from the standpoint of not having to deal with as many issues that are tangential to to learning in the classroom. So setting up this system and using it to strengthen the work of the school and make it more efficient and address all these different areas is foundational to helping students learn.
And I was just going through those 4 criteria, and each one of them links back to aspects or fundamental aspects of the WSCC model, whether we're talking about early learning and effective pedagogy,
Yep.
whether you're talking about workforce development and successful graduation, and you're talking about involvement and links back into the community, and so the school is not siloed. A focus on safe and healthy, that's what WSCC is all about.
Yeah.
But then also educator retainment. It's true that one of the number one reasons why new teachers leave the profession is because they don't feel supported and they don't have strong connections.
Yes.
So by forming these connections, by focusing on relationships, by focusing on the sense of the health and also sense of safety of not only of the students, but also of the staff and the teachers, also goes a long way in improving that school climate and making sure that people feel part of the school. Like all of us, to be honest, I often go back, and it's the same with health professionals, but I go back and talk to teachers and educators about why they got into the profession. Very few of them got into the profession because of a love of an algebraic formula or a semicolon, although that might be the vehicle that they see as being beneficial. They go into it because they believe they can make a difference. They go into these roles because they believe that education is one of the best vehicles to help the individual, but also help their society and their community. And then subsequently, they leave the profession if they feel that that's not the reason why they're there. The WSCC model is trying to re-emphasize the health, the well-being, the belonging, the purpose around health and education, and then trying to give a framework so that states, but also districts and schools can make sure they have the right stakeholders and the right people at the table.
Wow, that kind of sums it up, I think, very well, especially because you actually jumped ahead to my last question, which is how does the WISC model integrate? Well, there you have it. You just integrated it all into certainly what DESE is doing. And that's exciting because that is DESE's priority. And we love the fact that you're supporting our state with this initiative. Now, I know Bill is a little biased with you considering where you got your master's and your undergrad. You know, we know that, you know, you certainly love the Show Me State, but the bottom line is, guys, you know, this is very important to our state. You know, Laura Beckman, our director of Missouri Healthy Schools, this is one of the top initiatives to get more schools educated on this process, on this framework, on this model, because it works. And I just want to thank both of you guys for appearing today on our first ever Mo Health Media broadcast. And I do like to do one little kind of, every time I interview someone, I always like to ask a question you have no idea about. So here it goes.
Oh, here we go.
Because I don't want everyone just to think you guys are all about the WISC model. So from doing my research, I heard from a very reliable source that you guys have been together for nearly a decade, you know, working up the WISC model, and you guys occasionally will sometimes travel, you know, all around the country, or excuse me, all over the world, all over the globe. And you guys happen to have some sort of ritual. And I was wondering if you would be mind sharing with our viewers right here in the Show Me State, how you guys take in some of the local activities, if you would, as you guys travel through some of these countries.
Well, it is true that once in a while we wind up in the same city at the same conference, and often that's planned and sometimes it's not. But when we do, we try to go to a local sporting event. We've been to soccer in Brazil, Thai boxing in Thailand. We've been to baseball in Mexico City. We've done, you know, a variety of different sporting events. We've enjoyed doing that together.
And Sean?
We still have to meet up in Australia sometime, Bill, so I can take you to an AFL Australian rules football game or a cricket test match.
Absolutely. I look forward to it.
That's awesome. Well, guys, it's all the time we have here on the Mo Health Media broadcast. Just want to, as a reminder, we'll be putting out information on the statewide webinar will be on October 7th and as well as October 16th, where you get the opportunity to hear both these guys speak, as well as some other featured guests. Thank you guys for tuning in on our very first broadcast right here on Mo Health Media. Thank you.
Thanks very much, Guy.